State Representative Holly Cheeseman. I represent the 37th District, which is East Lyme and Salem, and I want to thank you for holding this hearing today. I come to you with with experience of actually buying on the individual market. If this were 6 years ago, I would be sitting here as a member of the public. When my husband died and my son and I had to take out individual policies, we were lucky. We were underwritten. And my son, then aged 25, was paying $87 a month. Yes, it was a high deductible plan, but it provided 3 primary care visits with a $15 copay. I paid $267 a month. Fast forward 5 years, my premium would have been $1,000 a month for a Connecticut-only HMO with a $5,700 deductible. I have seen the cost of health insurance, and indeed, having insurance doesn't mean you actually can access that care. Your deductible may be too high. Anecdote is not data. I remember having a dog bite and deciding I was better off putting butterfly strips on it than going to the emergency room because I would have that full out-of-pocket cost. So I think we have to remember the price our residents are paying, that their families are paying, and indeed the small businesses are paying. We've seen the Inflation Reduction Act pass on additional subsidies. That's not going to help those small businesses in our state who want to do the right thing by their employees, yet are increasingly seeing huge increases and have no alternative but to pass them on to their employees. So I would urge that we look again at these increases. I think they're too high, but I also think, and I welcome that October 3rd meeting, because none of this can be fixed without putting everyone round the table. We are looking at an increasingly monopolized healthcare system in Connecticut with 2 major hospital groups. St. Francis suing Hartford Healthcare for basically restraint of trade, for buying up hospital practices. How many of you go to doctors who are in individual practice anymore? We have made it virtually impossible, and I include government, because what we demand of the individual provider, they no longer can or want to supply. Our drug companies, yes, we save millions in later healthcare costs, but I was very proud to be part of the drive in Connecticut to cap insulin prices. That's a drug that's been around for a century. Yet why should its price have increased? You look at your explanation of benefits. A $10,000 bill is now $2,000 to the insurance company, and the hospital accepts that in payment. I'm not seeing that they're making an $8,000 loss. So we need a real holistic conversation about healthcare costs and how we keep our residents healthy and safe. We need to look at what other states are doing, whether it's benchmarking, caps on prescription drug prices. How do we make it affordable, keep our residents healthy, keep the insurance companies? We want survival for all. But that doesn't happen without having an honest conversation where we can look at the drivers, look at outcomes. Preventable medical errors, but you read between the 3rd and 8th leading cause of death in the United States. Everybody should have skin in the game here as we go forward. So I welcome this opportunity to speak. I look forward to the insurance department reassessing these requests, but I also look forward to that honest conversation where we can actually discuss how to provide affordable health care for our residents that provides quality, accessibility, and affordability. Because that's the goal at the end of the day, and the citizens of Connecticut and everyone who supports them and works for them deserve no less.